1. Which of the following blood collection tubes is most appropriate for a coagulation study? A. Red top. B. Light blue top. C. Green top. D. Lavender top. 2. Which gram-negative bacterium is most commonly associated with urinary tract infections? A. Escherichia coli. E. Pseudomonas aeruginosa. C. Proteus mirabilis. D. Klebsiella pneumoniae. 3. In quality control, what is the primary purpose of Levy-Jennings charts? A. To detect clerical errors. B. To monitor analytical precision and accuracy. C. To record daily workload. D. To manage reagent inventory. 4. What is the primary antigen detected in the hepatitis B surface antigen HBsAg test? A. Viral nucleic acid. B. Envelope protein. C. Core protein. D. Surface protein. 5. Which staining technique is most appropriate for identifying Mycobacterium tuberculosis? A. Gram stain. B. Acid-fast stain. C. India ink stain. D. Wright stain. 6. Which of the following is a primary function of neutrophils? A. Antibody production. B. Phagocytosis of bacteria. C. Histamine release. D. Parasite defense. 7. What is the recommended temperature for storing packed red blood cells in the blood bank? A. 1 to 6 degrees Celsius. B. 20 to 24 degrees Celsius. C. Minus 20 degrees Celsius. D. 30 to 37 degrees Cs. 8. What does an increased reticulocyte count typically indicate? A. Bone marrow suppression. B. Hemolytic anemia. C. Iron deficiency anemia. D. Aplastic anemia. 9. Which of the following tests is most specific for diagnosing infectious mononucleosis? A. Rapid strep test. B. Heterophile antibody test. C. ANA test. D. Blood culture. 10. Which biochemical test result is characteristic of Streptococcus pyogenes? A. Catalase positive. B. Coagulase positive. C. Beta hemolysis. D. Uricase positive. 11. Which type of hepatitis virus is transmitted primarily through the fecal-oral route? A. Hepatitis A. B. Hepatitis B. C. D. Hepatitis D. 12. What is the purpose of using a Wright GM sustain in hematology? A. Detecting fungi. B. Differentiating white blood cell morphology. C. Identifying lipids. D. Detecting spirochetes. 13. Which blood group antigen is the most immunogenic after ABO? A. Kell. E. Duffy. C. Wright D. D. Kidd. 14. What is the role of the citrate in the light blue top coagulation tube? A. Chelates magnesium. B. Chelates calcium. C. Provides clotting factors. D. Stabilizes hemoglobin. 15. Which immunoglobulin is first produced during a primary immune response? A. IgG. B. IgM. C. IgA. D. IgE. 16. Which organism is associated with the production of a fried egg colony appearance on culture media? A. Mycoplasma pneumoniae. B. Legionella pneumophila. C. Corynebacterium diphtheriae. D. Treponema pallidum. 17. Which test is most commonly used to monitor heparin therapy? A. Prothrombin time, PT. B. Activated partial thromboplastin time, APTT. C. Fibrinogen level. D. Bleeding time. 18. What is the main function of basophils in the immune response? A. Phagocytosis. B. Release of histamine and heparin. C. Antibody production. D. Killing of parasites. 19. What type of hemolysis is produced by Streptococcus pneumoniae on blood agar? A. Beta hemolysis. B. Alpha hemolysis. C. Gamma hemolysis. D. Double zone hemolysis. 20. Which of the following is a confirmatory test for HIV infection? A. ELISA. B. Western blot. C. Rapid immunoassay. D. CD4 count. 21. Which of the following is the gold standard for malaria diagnosis? A. Antigen detection test. B. Thick and thin blood smears. C. PCR. D. Rapid diagnostic test. 22. Which condition is associated with the presence of Howell-Jolly bodies? A. Sickle cell anemia. B. Megaloblastic anemia. C. Postsplenectomy. D. Iron deficiency anemia. 23. Which type of hypersensitivity reaction is associated with hemolytic transfusion reactions? A. Type I. B. Type 2. C. Type 3. D. Type 4. 24. Which microorganism is most associated with pseudomembranous colitis? A. Escherichia coli. B. Clostridioides difficile. C. Salmonella enterica. D. Shigella dysenteriae. 25. Which test is most appropriate to detect syphilis in its early stage? A. RPR. B. VDRL. C. FTA-ABS. D. ELISA. 26. Which hormone is measured in newborn screening for congenital hypothyroidism? A. Thyroxine T4. B. Triiodothyronine T3. C. Thyroid-stimulating hormone TSH. D. Calcitonin. 27. Which of the following is a function of the complement system? A. Antibody production. E. Opsonization and lysis of pathogens. C. Antigen presentation. D. Clot formation. 28. Which blood collection error most commonly causes hemolysis of a specimen? A. Using too large a needle. B. Shaking the tube vigorously. C. Inverting the tube gently. D. Drawing blood slowly. 29. What is the primary screening test for hemoglobinopathies? A. Electrophoresis. B. Osmotic fragility test. C. Reticulocyte count. D. Iron studies. 30. Which test is most appropriate for monitoring warfarin therapy? A. APTT. B. PTINR. C. Thrombin time. D. D-dimer. 31. Which parasite is identified by the presence of a characteristic ring form inside red blood cells? A. Plasmodium species. B. Giardia lamblia. C. Entamoeba histolytica. D. Toxoplasma gondii. 32. Which lipid is most strongly associated with the development of atherosclerosis? A. HDL cholesterol. B. LDL cholesterol. C. Triglycerides. D. VLDL cholesterol. 33. Which of the following markers is most commonly elevated in myocardial infarction? A. Amylase. B. Creatine kinase MB, CKMB. C. Alkaline phosphatase. D. Bilirubin. 34. Which enzyme deficiency is associated with hemolysis after ingestion of fava beans? A. Glucose 6-phosphate dehydrogenase, G6PD. B. Pyruvate kinase. C. Lactate dehydrogenase. D. Hexokinase. 35. Which anticoagulant is used in a lavender top tube? A. Heparin. B. Sodium citrate. C. EDTA. D. Sodium fluoride. 36. Which virus is identified using the monospot test? A. Cytomegalovirus. B. Epstein-Barr virus. C. Varicella-Zoster virus. D. Human papillomavirus. 37. Which method is most appropriate for sterilizing heat-sensitive laboratory equipment? A. Dry heat. B. Steam autoclaving. C. Filtration. D. Incineration. 38. Which type of urine crystal is commonly seen in patients with ethylene glycol poisoning? A. Uric acid crystals. B. Cysteine crystals. C. Calcium oxalate crystals. D. Triple phosphate crystals. 39. Which vitamin deficiency is most commonly associated with prolonged prothrombin time, PT? A. Vitamin A. B. Vitamin B12. C. Vitamin D. D. Vitamin K. 40. Which red blood cell inclusion is most associated with lead poisoning? A. Heinz bodies. B. Pappenheimer bodies. C. Basophilic stippling. D. Howell-Jolly bodies.